So this article, this editorial from today's The Hindu is about public health financing and governance. So it talks about that building a strong public health system tends to start with financing. Very much true. If you want to build a strong health system, you should need to have very good, strong finance, good budget. It compares developing countries and developed countries, and it says that even in terms of spending, the LMICs, means the low and middle income countries, they may be catching up with the developed countries when it comes to about the spending in total in the to overall GDP level. But in per capita terms, the gap has in fact expanded more than threefold during this period. Certain period is being mentioned between 2002 and 2023. In the gap of 23 years, the gap between developed countries and developing countries has increased when it is about per capita expenditure in health. We will look into it, what it all means. Then it actually highlights certain reasons or issues why this expenditure or spending on health has declined. A very good term over here is development assistance for health, DAH. So DAH is a term that means that developed countries providing financial support to the developing countries to strengthen the national budgets of LMICs as an aid. When the developed countries are giving the aid, it is called Development Assistance for Health, DAH. So it says that after the COVID pandemic, this DAH system has declined a lot. So if the developing countries are not getting the kind of aid they were receiving, the kind of help they were receiving from the developed world, obviously there will be having some kind of resource crunch. Then it is also talking about the national budgets of the countries like India or other developing countries. These national budgets are strained. Why they are strained? Because of the rising public debt and its costs. So there is a lot of public debt among the countries. So to service those debts, like to pay interest, to pay clear out the dues, lot of national resources, a good portion of the national budget is going for that. So that ultimately leading to reduction in budget for sectors like health. Then it is telling that public sources drying up, it is unlikely that more money will flow into health system. Obviously, public sources are drying up, then obviously it will have some impact on other sectors. So then it will talk about way forward, maybe to spend available money better. So if we cannot spend more on health, then the ultimate solution is to that whatever we are spending, we should spend it more efficiently, more effectively. So it gives first a couple of suggestions. The first suggestion given over here is to spend what is allocated. If only 100 rupees are allocated to health sector, please ensure that this 100 rupees are spent effectively, efficiently. How so? It is you can prioritize the certain sectors in health, certain areas in health on which you can spend more. It talks about something like that. So there is a deprioritization of health at the implementation state of the budgets. So it gives some data, and it says that just 26% of the money earmarked for communicable and non-communicable disease programs was actually used that year. So whatever money was allocated, budgeted for to be spent on communicable and non-communicable diseases, only 26% was spent on those. So it is whatever even was allocated, we are not able to spend that effectively. Then it gives a second suggestion. Second suggestion is that spend on the right things. Spend on the right thing. First thing is that whatever is allocated, you spend it properly. Second thing is that whatever you are spending, you spend it on right things. What could be the right thing? First, it identifies some issues that when it comes to wages and salary budgets, they are like implemented in full. Salary of doctors, salary of other workers, administrative staffs, they are like spent totally, completely, fully. But when it is about goods and services, there is underspending. When it comes to buying some like procuring some equipments for health, for example, take ultrasound machines or ventilators, then there is not that kind of efficient spending. It gets delayed, or there is also corruption in procurement. When it is about services, spending on better services for the patients or the public, then the spending is not of that much full quantity and quality. Also, workers are not well equipped to deliver quality health care. So workers are also not equipped. There is a choice to be made in terms of the tiers of healthcare that prioritized in public spending. You need to categorize, segregate that, okay, this is the tier of health, and this much amount should go to the lower tier, this much amount go to the upper tier. Tier means based on priorities, based on importance. A lot of money goes to the curative care at the secondary and tertiary level. So presently it says that curative care, a lot of money is being spent on curative care at the cost of preventive and primary health. Curative means after a disease is being diagnosed, then money is being spent on curing that disease, and a good amount of the budget is being spent on curative functions. So it talks about that we should spend on preventive functions as well. Preventing means if you are creating good awareness, if you are having proper vaccination, if you have a strong primary healthcare systems in the rural and village areas, then like they are the first point of contact. So patients can reach out to those health centers, and they can get, like, before the disease takes the evil shape, they can get diagnosed very easily, and they can be cured at the primary level itself. So we need to spend on the preventive care more than the curative. Curative care is important, but we also need to give importance to preventive care. Then it says that public health money is best spent on classic public goods such as infectious disease control, sanitation. Why? Because there is a market failure in these segments. So understand this way, that if you actually want to improve health, you need to have very good sanitation. You need to have a good system that controls infectious diseases. Unless and until you are having this, you cannot think of a strong, better health of for the public. And these areas like sanitation, infectious disease control, private sector will not enter into this. So, and because that is not very it won't be rewarding in terms of profits. So it is a kind of market failure, and the government need to enter into it. So the private sector is already supplying competitively in certain areas like curative health services, for instance treating common illness. So there are lots of doctors, private doctors and private clinics, nursing homes, like they are giving treatments for common illness, cough, cold, and private sector is competitively providing services in those areas. But when it comes to sanitation, how many have you seen that there is any private company working in the field of sanitation? There is any private company that is working in the field of infectious disease control? So these are the areas in which actually the public health spending need to increase. So the public health spending markedly improves infectious disease outcomes. How? Through disease access, through vaccination, through sanitation, and these needs to be improved. Then it talks about third suggestion that it gives is that improve governance and operational efficiency. Need to improve operational efficiency and governance. So if corruption is reduced or the quality of bureaucracy improves, countries see greater positive effects of public health spending. That's very much obvious. So if it is about public health spending, and if our governance system is strong, and whatever money is being allocated from the central government or state government, then that money should effectively reach at the grassroots level, to the district level hospital or to the village level primary health care center. And that can only happen if the bureaucracy is working effectively, and there is not any, there is like very like no corruption at all. Unless and if there is corruption, then at the every stage, every level, when the money is percolating downwards, people will be like siphoning off some amount of money for themselves out of corruption. Then it is also talking about it gives like the simply increasing spending where governance is weak is unlikely to improve outcomes. So very important point it gives, that you cannot think that we will increase the spending so the outcome will also improve. No, spending is not directly proportional to outcome. Last year, suppose we were spending 100 rupees, so we got like controlled a disease. It does not mean that this year if we were spending 200 rupees, that then the outcome will also increase. We need to focus on the governance aspect. We need to ensure that the money is spent in a correct way, in a non-corruptive way. It also talks about increasing decentralization of public service delivery, so that focus can be made on improving governance at the subnational level. This is also a very good suggestion. Like decentralization of public service can be increased, so that there is a focus, there is improved focus of governance at the subnational level. Within governance itself, it talks about crucial role for public finance management. How the public finance is managed. Well formulated budget should be well formulated. Outlines, targets, expenditure should be clearly mentioned, and it should be implemented efficiently. The budget needed to be implemented efficiently. There is also need to improve budget credibility and cash disbursement. Involvement of public health providers in budget processes can enhance both accountability and motivation. So it talks in terms of accountability and motivation. So it is considered this way, that the budget is being decided at a higher level, for example at the ministerial level or departmental level, and the people who are actually entrusted with the implementing or spending the budget, those people are actually not at all involved in formulating the budget. So this point actually suggests that if the people who are involved in public health service provisions, like the people who are providers of public health, if they are also involved in the budget process in terms of discussions, in terms of taking suggestions, then it will motivate them, and it can also ensure their accountability. Then it talks about improving the procurement processes. The procurement process needs to be improved to achieve greater value for money in health sector resources. Budget should be flexible to respond to unforeseen circumstances. This is also a very good point, because if the budgets are not flexible, then we cannot respond to emergency circumstances. For example, take the example of COVID. During COVID, what was needed was flexibility. If the fund at the district level was allocated for, say example, for the building or for constructing the hospital building, but that construction of the hospital building was not a requirement at that moment when suddenly 100 of COVID patients were entering, because you cannot construct a building within 1-2 days. So there should be a flexibility that those funds can be utilized at the level of addressing the concerns or taking care of the COVID patients. So this is a very good suggestion given over here. So the case for enhanced spending remains. Its returns are greatest precisely where health outcomes are poorest. Hence, the money that is well directed can help narrow gaps across countries. So it talks about better direction of the money, better usage of the money, less corruption, and effective governance. Now we will move to our next article. This article is about education. How we are a rationalization of education is happening. So why are government schools shutting down? So first it talks about a Niti Aayog report which says that nearly 94,000 government schools were closed in the past decade, and there was a decline of nearly 2.26 crore, means 2 crores 26 lakhs school enrollment. Means whatever the enrollment was, the amount of enrollment was happening 2 decades ago, that that number decreased by this quantity in the last decades. And also the government school share in total enrollment has fallen from 71% in 2005 to 49% in 2024. So this is a very good scenario. So consider it like that. In 2025, nearly 75%, means 3/4, was like government school enrollments. But in 2024, it reached to nearly 50%. Right, this is what it is saying. So it is saying that, and this is why this is happening, because government schools have started getting closed. Nearly 94,000 schools have got closed in the past decade. Decades actually, in the past decade. So starting from 2005 to 20, it is talking about nearly 2 decades. Now, why the government schools are shutting down? A very good reason is rationalization. It says that on account of rationalization, the government schools are closing down. What is rationalization? Rationalization, you understand this way. Like suppose there is a school over here, school A, and there is a school 10 kilometers apart. This school is B. These are 2 villages, A and B, and they each have one school. This school has only 8 students, and this school has 12 students, for example. And to run this school, there will be need of principal, teacher, supporting staff, and the same applies to here as well. So the rationalization of schools, this concept says that in this scenario, merge both these schools. If it is merged, then there will be one school that will be having nearly 20 students, and the resource required in terms of teacher, principal, supporting staff, infrastructure, washrooms, that will remain the same. That cost will remain the same. So it is about rationalization. But the problem is, if you rationalize, then either this school will be closed or this school will be closed, or both will be closed and a third school will be located nearby. So if these 8 students, they were having a school very nearby to their village, they need to travel to this school which will be far away, or they need to travel to this school which will be far away. The same applies to this. If this school is getting closed, then these 12 students need to travel far away to this or to this. So this is one of the reasons that is being highlighted over here, that rationalization is a very good idea to avoid wastage of money. But when it comes to the practical or on ground level, it is leading to low enrollment, it is leading to low attendance. These things are being highlighted in the article. So the government schools are being shut down because of rationalization. The National Education Policy advocates such rationalization. Very important point. This rationalization of schools is actually being provided in our National Education Policy, but without endangering the concept of neighborhood schools. So it is not that we should rationalize our schools, government schools, at the cost of neighborhood schools. No, that is not the idea. We need to rationalize, and that rationalization should be well thought out, well researched. So rather, it is a coordinated administrative decision where the poorest and most rural children have the least capacity to compensate for a school that has vanished. So like the same thing that I explained a while ago. So then it gives some example, like examples from Uttar Pradesh, Madhya Pradesh, Jammu and Kashmir. These are the major states where the government schools have been shut down recently. And it gives gives some data about like how in Madhya Pradesh students are being left out of school, how like there is a low enrollment rate. It comes out with a term called a Dropbox. Dropbox is a term for those at imminent risk of dropping out from school. So this Dropbox is a good term. UPSC is not going to ask you this term in prelims or mains, but if there is a question comes in mains, then you can use these terms like Dropbox. So a Dropbox means that suppose there is a family, this village has 100 people, and the school from here gets transferred to here. So the distance also increases from A to B. Now, because of certain reasons, be it in terms of financial constraints or societal pressures or any cultural issues, there are chances that students might not be able to travel and go to attend the schools. A lot of students may drop out of the school, that okay, we don't have any other option, so we will stop going to schools. It may apply to girl children as students as well as to like other marginalized students as well. So this is something called a term is being given called Dropbox. Then it gives certain data that these kind of like number of students are getting left out of the school because of the shutting down of government schools. So this data is not that important. What is important is the impact of shutdown of government schools. This is important. Like how this article, it will highlight how this government school system is very much important in terms of a country like India. So there is a very huge impact of shutdown of government schools. These government schools in India are not a neutral public utility used evenly across classes. They are disproportionately the schools of the poor, very much true, of scheduled caste, scheduled tribes, and the poorer strata of the backward class community. So what kind of people are actually sending their kids to the government schools? Most importantly, they belong to the lower strata of our society. For example, those belonging to SC, ST, lower caste or marginalized sections, people who do not have money to afford education for their children. So they are actually sending their children to the government schools. So that itself highlights the importance of government schools. So India is home to roughly 60% of the world's below poverty line population, and it is their children who fill the government classrooms. So if in your country 60% of the population is below poverty line, don't you think that it becomes very important, very significant that you invest good, efficient money in the government school sector? Then it also gives some other data, but we won't be looking into that data regarding like particular categories because we already discussed that. So the burden falls disproportionately on girls. So now it comes the concept of gender also. Here it was about society. Now it comes to gender. So one aspect we discussed the importance of government schools in terms of society. Second aspect we will discuss in terms of gender. So the burden falls disproportionately on girls, who are the first to be drawn when the nearest school stops being nearby. Very obviously, we also learnt a while ago. What consolidation looks like on the ground is often single teacher covering 5 classes at once, unable to know the individual child's background, tailor instruction, in breach of right to education act's staffing norms. So this talks about resources and manpower. So even if you are consolidating these schools, are you like going to increase the manpower, increase the number of teachers per children in this school, or you are like just keeping the resources same just by increasing the number of students. So if the number of students is increasing, don't you think that the number of teachers should also increase, so that there are ample number of teachers to take care of the students, to identify, to understand the individual child's background, or to tailor the instruction, to figure it out, like how a particular students need to be instructed. Now it talks about who is responsible for this trend. So not very much important over here. A good fact to be noted here is that education is in the concurrent list. So there is a discourse or debate among the political parties, like state governments also have the responsibility to improve education, and likewise the central government also has. That is very much true. You can use this in your examination, and in from prelims point of view, this is an important fact. It talks about like RT is a central act which mandates on neighborhood schools have the center's responsibility. The right to education is a central act. That does not mean that education is like only the center's responsibility, because implementation is actually happening at the state level. Then something called national education policy. It implementation and imposes a language policy, so it has own pros and cons. So when it comes to education, there are issues like implementation level issues. What are the implementation level issues? The first issue is like the central versus state. Both are arguing with each other, though both are blaming each other that this is your responsibility, this is your responsibility. Then it is about acts and legislations. You cannot put a blame on central government just because central government has a uniform act. Then it talks about the national education policy. National education policy, a very good policy, very good document, but when it comes to implementation, it talks about the language policy, that 3-language policy, and because of the language policy, several states are getting like feeling apprehensive that this kind of language policy, like this is also related to, this is also a political issue, that such kind of language policy will hamper their own inherent language. So these are some kind of implementation issues identified over here. The RTE Act, which has been in force since 2010, it guarantees free and compulsory education from 6 to 14. So this is about RTE Act 2009 actually, it is in implementation from 2010. So the first basic feature given over here, that it guarantees free and compulsory education from age 6 to 14. This is a very important fact. From 6 to 14 years, there should be free education by the government to the children of 6 to 14 years. This is a very important fact. RT says nothing binding about the quality of what is delivered. So RT is silent about the quality of education. It creates entitlements that children cannot assert on their own, often lack the legal and institutional capacity to enforce either. So RT is like top-down approach kind of thing. It has given like, okay, the government will provide so and so education services, but the people, the students, their parents, particularly the poor ones, they are not empowered enough to ensure that the provisions of those acts are actually implemented on ground. It assumes a symmetry of power between state, the school, and the family that does not exist on ground. So RT is not justiciable as such. No doubt you can like approach the court, but people don't have that kind of resources. One very important provision regarding this RT is that School Management Committee, SMCs. These committees are actually envisioned as a committee comprising the parents of children, like stakeholders involved at that ground level. Like suppose this is a school located in the village, then the children coming to that school, then the teachers, the other workers. So there is a school management committee that will oversee the functioning of this school, and broadly the parents of the children, students studying in that school, those parents are part of this school management committee. That means the stakeholders are thought to become a part of the committee, the committee that will manage this school. So this was provided in the RT, but on ground, this is not becoming a reality, because parents and communities, a formal voice, this largely go unconvened. So it is like talking about that RT has very good intentions, but when it comes to its implementation, there are challenges. When it comes to its enforcement, there are challenges. So having a law is a very good thing, but whether you are able to implement that law and whether that law is effective or not, that we need to work on. Next, we will look into the third article. This article is talks about actually a disease. That disease is leptospirosis. This leptospirosis is a tropical zoonotic disease. It is a bacterial systemic infection caused by pathogenic Leptospira. Then that means that if there is it is being caused by bacteria. It is being caused by bacteria. A pathogen. The name of the pathogen is Leptospira, and this is a systemic infection. This disease actually began to be noticed in Kerala in 1989, and it is endemic in the state. It is endemic in the state, and it is in the state since 1989. Now became the communicable disease with the highest mortality profile. So the concern is that despite being the disease being highlighted and noticed for such a long period, nearly 3 decades, why the disease is still prevalent. Then it also talks about that this disease is not just because of about Kerala, it is also endemic in 12 other states. But because Kerala has a better disease surveillance, extensive diagnostic facilities and aggressive logging of both confirmed and probable cases, that make Kerala seem like the state with the highest leptospirosis burden. So it talks about the good governance in Kerala that is actually leading to a improved identification of the disease. So that may seem like the Kerala is like reporting a lot of cases. Kerala is like high burden disease, but that might not be the reality. It talks about why Kerala why Kerala is a hot spot for the disease. Very special thing is that about environment. A heavy monsoon, frequent floods, year-round moisture and humidity. It creates ideal survival conditions for this bacteria in soil and water bodies. So first important thing that you need to know that this is a tropical disease. This is a disease caused by bacteria. This is a disease caused by, you will learn in a while that how it is being caused by rodents, means like carriers of the disease. There is some other animals, other species which are carrying the bacteria, and the disease is being transmitting from those animals. Bacteria is being transmitted from those animals to human. How it is being transmitted? So like it is abundance of rodent and animal reservoir hosts. This is all related to the particular environment where this kind of bacteria like increases or rapidly multiplies. Paddy cultivation, pineapple plantations, canal cleaning activities expose large number of agricultural and manual laborers to contaminated water, leading to Leptospira bacteria enter the body through mucosal surfaces, abrasions or broken skin. So it is like the bacteria need to enter your body. It can enter how? Suppose this is the skin. If the skin has somehow become like there are rashes or the skin has got broken because of any kind of injury, and if that wounded skin comes into contact with the contaminated water, then the bacteria may enter that area, and from that area it may enter in your body, and the disease leptospirosis can be caused. It talks about the occupational hazard with people engaged in farming, dairy farming, cleaning work. Ultimately, it is about coming in contact with the contaminated water. So this is like other thing, these are not that important. It is basically talking about how late diagnosis, rapid progression disease. So in all the health related articles or all the health related issues, you will be knowing that what are important. Diagnosis is important, right? Diagnosis is important, timely diagnosis. The public health system is important, right? What else is important? Timely treatment. Timely treatment is important. The medicines affordability. Treatment should be affordability. So these things apply to all kinds of diseases or health related issues that you may encounter. The same things are being identified over here, but in some fancy and technical language. So we won't go in that much detail. What is important in this article is about this disease called leptospirosis. What it is, how it is being caused, what are the career or what are the career species like rodents and animals, and how it spreads through contact.